So what we should do, I will talk, and then how to manage long-term complications. And then some complications can be cured by the retransplantation, but we cannot. The factors after long-term performance are very quickly reviewed. And then advanced care partner, I would like to speak later. Okay, so these are the major complications after transplantation, and the coronary artery vasculopathy. We can call it the chronic rejection, renal dysfunction, and the PTLD malignancy. They develop these after transplantation, and then we can use some drug treatment, and then so MTOR inhibitors. You may know everolimus or sirolimus, and that would be the key drug for them. And the CMI minimization, CMI means the calcineurin inhibitors. That may cause some complications, so we have to minimize those drugs. And the first coronary artery vasculopathy is described in this slide, and then the coronary narrowing like this, and then this is not like, this is atherosclerotic, the change of the coronary, and these are the transplant coronary artery disease. And then this is some of the immune-mediated, and then intermorphic. And then it's called sudden death. And the sudden death frequency is very high in the transplant recipient. It is over nearly 100 or 1,000 times higher than the normal population, the sudden death. That is because the transplant heart is denervated, so the patient doesn't feel any pain. How to the prevention and the occurrence of the progression is very important. So this year the guideline was updated, and I'm a member of the guideline, the writing committee, and then so the most important issue is the MTOR inhibitors use and statin. And statin, independent of the cholesterol level, and is shown as a class 1 and evidence level A. So all transplant recipients should be the prescribed the statins. But even though the only drastic treatment method is heart retransplantation. And then so this slide shows the how to use sirolimus. So sirolimus, the introduction within 2 years can cure not cure, but reduce the risk of the cardiovascular death or cardiovascular adverse event. And then the PCI and then some invasive method is also they performed sometimes, but the approach is very difficult. So retransplantation is only the treatment for the coronary artery vasculopathy. And then the kidney function before and after transplantation, that means ventricular assist device, and the many issues that affect kidney function, and then the end-stage heart failure patient has a low output syndrome and renal congestion, and at that time we have to determine the reversibility of renal function, and then ventricular assist device can cause some infection, and then antibiotics the selection will be important. And then after transplantation, patients are put on the calcineurin inhibitors. So calcineurin inhibitors may cause kidney dysfunction. So contrast media, like patient require biopsy or coronary angiogram and that damaged kidney. And then sometimes we use, so MTOR inhibitor, it is called renal sparing strategy, but it also, we don't know the outcome of the kidney recovery, so we have to be very much careful with renal function after transplantation. And then before the renal function so this is right how to predict the renal recovery. I would skip the creatinine and patient background, and we can predict how the kidney function can recover or not. So I can just skip it. And then after transplanting on mechanical little, but after that, because patients are put on, patients are put on the calcineurin inhibitor. so it may not recover it. And then if kidney transplant is performed after renal dysfunction, and then in heart transplant recipient, the survival getting better, but just medication or dialysis, and the prognosis is very worse, very bad. So for renal dysfunction, again, everolimus, and they can be used. So, well, mTOR inhibitors use is very a kind of key to preserve renal function after transplantation. So, renal sparing strategy this is called. So, the meta-analysis also showed the favorable effect of mTOR inhibitors. And the malignancy is also very much the issues after transplantation. And then these are the risk factors. And then also the immunosuppressive drugs are affected malignancy outcomes, especially the calcineurin inhibitors like cyclosporine, tacrolimus. That is that causes the increased risk for developing malignancy. And then these drugs, and also the thiopurine also make the calcineurin exposure, and then increase the risk of developing malignancy tumor with the thiopurine. And then also the immunosuppressants, they cause the B cell disformation, and then they increase the EB virus infection, and that may cause the suppress T cells, and then it can cause PTLD, the proliferative disorders. So, well, and then for malignancy, the mTOR inhibitors can do the favorable effect. Okay, so I'm sorry, some captures written in Japanese. And then, so anyway, mTOR inhibitors show the favorable effect to prevent the malignancy occurring.